So here's a mistake that I made that I see a lot of other people making. There's a medication out there. It's called Quantipen is a generic. Long, and it's an antipsychotic. The side effects are long and crazy, and when mixed with other drugs, like I'm talking about prescription medications that doctors tell you to take, it can go really wacky. I'm telling you. People who have taken it said that they can't even move, that they see things that aren't there, they piss on the floor. Just it's a horrible medication. And I spent a couple months on it again, stupidly, right before one of my last seizures. And that's one of my toughest ones because my roommate was acting very, very, I mean, this is a very nice way of putting it, inappropriately. But I also was on Quantipen, as well as I think there was two others that the doctor wanted me to take. And that's because these were in my medication past, and this is what my mother wanted me to take. I was on that with my mother as well. Same medication. She told me I had to take it my whole life. Now, I just wanted to sleep. I just wanted to sleep. I just got my doctor back. I just got an ID. I'm in the doctor's office. A psychiatrist, the ones that prescribe psychiatry meds. And I just say I want to sleep. I've been on this medicine, this medicine, this medicine, this medicine, this medicine, this medicine. I give him a big list, and I tell him, these two made me drowsy and put me to sleep, but there was a lot of side effects. And I tell him some of the side effects, and he says, well, we'll put you back on it. And I started taking it. I also told him about my suicide past, my depression past, and I had the connection in my brain already, but I wasn't really coming forth with it yet. I didn't like, I had some writing about it, but I was just telling them my side effects, my med past. I was telling them how I was disabled. I was basically saying the same thing as this recorder, but very condensed. They only give you like 5 to 30 minutes to say everything. That's it. Sometimes it's broken up because they want to speak too. They'll interrupt you, they'll ask a question, and then when you try to answer the question, they'll interrupt you and ask you another question before you finish. So before you finish answering one question, they want to know another. So it makes it very difficult to get anywhere with them too. But anyways, they give me the prescription. I'm taking that prescription as prescribed. I have a seizure, I hit my head, and my roommate leaves me there for days. And in between those days, I try to commit suicide. Now that's stupid. I just take a bunch of pills that helped with the seizures before, but that's stupid. And I went off everything right after that. I really addressed my situation, and I wanted to do more therapy to process this pill issue. I was only for a couple months again that I went to see this doctor, and it seemed to have a dramatic effect in no time. So I had to look into this, and I did. I've been looking into it for 25 years, but this time I got to stop taking everything. No drinking, no smoking, and no pharmaceuticals from doctors. That was the big one. And after I did that, I saw a big difference. Getting sober, that was hard. I got that done. But I also had to be careful with psychiatry meds. Not that I'm taking too much or too little or that I need them for the rest of my life. It's that all these psychiatry meds that I were taking, they would have side effects. And what am I taking them for? Sleep. That's all I'm wanting to do. I want to sleep. I want to stop shaking. I want to not feel this lightning down my spine. I want to not be numb, like be able to kind of feel my skin when I'm holding a coffee mug. I want to be able to kind of skateboard or do things and like that. Well, I'll never be able to do. I want to be able to move my legs to walk. I want to be able to do the normal regular things that people do. And then when I address that, I go, well, if I have the mental health down, if I'm just anxious, if I'm just scared because of my past and I'm just having to deal with the memories of all these crazy things that happened to me and crazy things that were done with me, well, I can move past that. I'll just have to do some serious therapy. So I did. This time I even did, like I said, the psychoactive therapy. And boy, was that intense. But I did feel a lot better later. Plus, writing it down, telling other people about it has helped extremely. But the main thing I got to do now is stay off of anything that's going to get me sicker or cause any bad effect on me. I even have to be careful with the anti seizure medications If I start feeling depressed or suicidal from those, I got, tell the doctor right away. And if he doesn't do anything, demand another doctor. And if that doctor does the same thing, well, then I'll just go off the damn things. And I'll have to go see a doctor and restart. I mean, that's it. But I've realized that all this psychotic, crazy talk about me, all these pills that I was taking, was part of my damage, part of my problem. Getting sober didn't fix me. No, it didn't. When I got sober, I still had a lot of mental issues. I mean, and I'm still taking care of other people, but that's not the problem. Well, I'm suffering and nobody's helping me, but what do I do about that? And now I'm having a seizure. I'm not sleeping. I take a sleeping med and a cocktail of other meds, and I get a lot worse for a couple months. Then I stop and I get better again. Oh, that makes sense. And that's a pattern that continues. You take away the meds, I get better. You start giving me multiple meds, I get worse, depending on the medication. If it's seizure medication, oh my God, do I improve. I had like an 80% improvement of the shakes, walking, movement with this oxybazepine, I think they call it. It's a generic for Triliptal. Don't get it confused with one of those crazy pills that they put me on as a child. There's another crazy pill called Lamictal. This one that I'm taking is called oxycarbazepine. Oxycarbazepine. Anyways, it's a generic for Triliptal. 150 milligrams. Yep, Triliptal. Now, there's a lot of medications like that, but this one's for seizures and epilepsy, and it only helps a little. They also use it for people who are having seizures from alcohol. That's how I discovered it. I had a doctor in a place called Matsy. That's an alcohol detox for, well, I actually asked the hospital to section me. I really needed to figure out, I was having seizures without the alcohol at that point, so I had to figure it out. And the doctor saw how much I shook, saw how much I was like seizing in my room. I was holding back the seizure, the full-blown blackout seizures I was holding back. He prescribed me this, and I noticed it really made a difference, and I didn't have a seizure. I knew I was going to have one. I knew I was going to have one, and then in that place he gave me this, and I didn't. So I remember that from 8 years prior. I was like 22, maybe 23, something like that, maybe as early as 21. And so I asked the doctor if that could be something that might help. He said, yes, definitely. And I'm seeing like an 80% improvement. The only problem is that I have something wrong with my GI infection, and it's extremely painful. When I move, lay down, it goes to my back, and when the pain throbs or sends a signal, of course, my nervous system doesn't like that. My pre-existing condition does not like infections, not one bit. I figured that much out. But anyway, so there's a lot of medications that can be used, but I have to keep an eye on the side effects, really careful. I also have to not listen to that crazy, crazy fantasy that my mother spun. I have to be very careful because that was just some crazy craziness. I've tried it a million times. I've tried listening to her, and it gets me in trouble. That's all it does. I mean, a lot of her advice and a lot of things that she was doing, I now know was clearly wrong. You don't give extra medication to your son for any reason. Definitely not Epicac. You don't let your son give medications to anybody else ever. You don't take your son's medication from his bottles ever. A lot of these behaviors and a lot of these behaviors she was teaching me are totally bonkers and I should never do. Like just taking these pills blindly from a psychiatrist that she made a bunch of lists with and made up a bunch of stories with is a stupid idea. It got me seriously hurt, and if I go along with it, I'll continue getting hurt. So at least I know that now. At least I have that. By the way, they have a documented seizure that day too. They have eventually I did make it to the hospital. They went over some of the things, but I left shortly after they did the brain scan and diagnosed the seizure because I told them what happened in the bedroom when the blood was on the wall. I couldn't move. I needed help, and my roommate did some stupid ass shit. So I told them about that, and after I told them, they weren't acting respectful. They were being totally hurtful, and I should have expected that from this hospital. This doctor has malpracticed a lot of people. Even and other doctors have mentioned this to us. So, yeah, I should have expected that he wouldn't take me seriously. Plus, with all this made up mental health stuff that my mother did, everybody's going to think I'm just some psycho person. There's a lot of mental people out there that really just want money or they want attention or they want. No, I don't want any of that. I just want a neurologist to fix my nervous system and then work. That's all. I'm working still. I mean, I work right across the street, Doc. You'll probably run into me. I mean, you'll need your gas sometime. And I run a business sometimes for 12 hours back to back with very little difficulty when it's warm. If the air conditioning is too high or if it gets winter, that's a totally different story. As well as loud noises when the alarm goes off, customers have to wait. I have to plug up my ears and I have to turn off the alarm before I talk or do anything else. So there are some problems with my nervous system. As well as if I get an infection or a broken leg or anything like that, it might be difficult for me to move or talk. And that's a whole nother problem. And this has been going on for 25 years. It's just getting closer together now. It used to be like every 3 years a full blown seizure, and then a lot of twitching and pain and suffering in between them. But now the pain is more severe, the seizures are getting closer together, and it's more intense. But that's expected after 25 years of no proper treatment, as well as a lot of these medications make it worse as well. Makes the depression worse, makes my impulse control worse, definitely makes my seizures and my neurological condition worse. And I think my mother might have known some of this too. If she was really a nurse, then she should have known some of this stuff. That's what really scares me. Because she should know all this. She should know better. I mean, if I know better at my age, with no medical training or no college medical training, then she should have known better for sure. Then what the hell was she doing to me? I know now kind of what she was doing to me, but I really would like to know more. I mean, I need more information from a lot of people. Um, all I can know is what I know for sure. I know facts, and those facts are scary.